My name is Tamara Nash. I'm a member of the State Bar of South Dakota Lawyers Assistance Committee. Being an attorney is so stressful, and we tend to absorb that stress into ourselves, and we fail to realize the impact that it has on us and the trauma of the things we see every day, what impact that has on us. So it's important to take a step back and realize that we may need help too, or those around us may need help. And so lawyers assistance programs help us with the tools that we need to educate ourselves and to reach out and be a friend to those in need. Please take a moment to learn more about mental health, substance abuse, and addiction, and how we can live above the bar.
As individuals age, some develop cognitive impairment that may impact their ability to deal with client matters. There is a national dialogue going on regarding this issue that impacts our ability and our responsibilities, including our licensures, our rules of professional conduct, and even our continuing legal education. Dr. Singh and I will discuss this topic impacting many of our professionals, understanding and identifying a cognitive impairment. But first, Dr. Singh, thank you for joining us today.
Thank you.
Will you please start by describing what is a cognitive disorder and what are some of the more common cognitive disorders?
So when we talk about cognitive disorder, it involves a complex array of symptoms. The most common symptoms are attention and concentration, even though we tend to focus a lot on memory. Generally, when you have these conversations, a lot of people will talk about memory problems. But generally, the more common symptoms that we see with cognition are attention and concentration. So you might have an individual who will struggle with organization, distractibility. You might see some changes in personality with cognitive disorders. You might see some changes in their level of impulsivity with cognitive disorders. So if you see a spectrum of these symptoms emerging, you might be dealing with somebody who has some underlying cognitive issues.
What are some of the causes of cognitive disorder?
The most important cause of cognitive disorder is aging. So if you look at neurocognitive disorders, the biggest risk factor for neurocognitive disorders is aging. Since there is not a whole lot we can do about aging, this is a disorder or a problem that we will all be dealing with somewhere, sometime in our lives.
When you have a patient come in to visit with you, what are some of the common signs or symptoms that they report to you that you then consider to be cognitive disorder?
So usually age. So the first and the foremost part to keep in mind is age. Usually I don't think in terms of a cognitive disorder if I have somebody who comes in and they're under the age of 50. Now, generally that is not common. Now, there are certain kinds of neurocognitive impairments that could occur before the age of 50, but those are generally not that common. There are certain forms of neurocognitive impairment like frontotemporal dementias that will start much earlier on. You will see them in early 50s. Average age of diagnosis is somewhere between 55 to 57 years. The most common presentation for frontotemporal dementia is a personality change. So suddenly you have somebody who was very empathetic, very caring, will suddenly become more angry, more belligerent, and people around them will notice this change in their personality. That could be an underlying issue. So they might be referred to me because of this personality change. And so then as we are having this conversation, I'll assess them for neurocognitive impairment. Other forms would be Alzheimer's, dementia, and that can also occur early, but the average age of onsets is usually mid-60s. So around 65 is the average age of onset for dementia that might be related to Alzheimer's disease. Then there is another form of dementia called Lewy body dementia, where you will have a symptom complex which will almost look like Parkinsonian symptoms along with their memory and cognitive impairment.
And Dr. Singh, every once in a while I will go into a room and realize that I forgot why I came into the room. Is that something that I should be concerned about?
No, I wouldn't worry about that. I always joke about this, that people who walk into my office saying they want to be evaluated for an underlying memory problem usually do not have a memory problem. People who have a memory problem will not necessarily realize that they have a memory issue. It'll be people around them who will notice this neurocognitive impairment, not the patient by themselves. What you're describing is a lack of attention. If this continues to happen at a very significant level, that it causes significant amount of impairment and it affects your ability to function, then yes, I would pay attention to it. But once in a while, if you're distracted, you're busy, you have a lot on your plate, it is normal.
Is there any sort of self-assessment that one can do to determine if they have a cognitive disorder?
Generally, there are multiple tools that are available, but nothing that is very evidence-based. Generally, what we do in clinical practice is a screening tool called the Mini Mental Status Exam. That is a bedside tool that can be used. But generally, relying on friends and family to give you feedback, if friends and family are telling you that they have had to repeat information to you over and over again, if people are noticing that about you, if they're noticing a change in your personality, these would be clues that I would pay more attention to.
Are there co-occurring issues that someone should be concerned about if they're noticing some of these signs and symptoms you've described?
Yes, all neurocognitive impairment is not just neurocognitive impairment. It could be related to an underlying depression. Patients who have severe depression might manifest symptoms of inattention, poor concentration, and memory issues. Patients who have uncontrolled anxiety might come in with symptoms of poor attention, concentration, racing thoughts, poor distractibility. So you have to make sure that there are no other underlying mental health issues that are confounding the picture there.
Dr. Singh, can you give us an idea what the treatment would look like for someone with a cognitive impairment?
So if somebody is diagnosed with neurocognitive impairment, the earlier they are given this diagnosis, there are medications that can help improve cognition or at least slow the process down. So you want to go and talk to your primary care physician. Exercise is an important part, staying active, staying healthy, and being active from a mental health standpoint, keeping yourself active, doing activities that involve a lot more thinking and doing puzzles, doing things that keep you active from a intellectual standpoint are something that you can do and would be very helpful.
If you have a colleague or a friend or a close relative that you think may be suffering some of these signs and symptoms of cognitive impairment, do you have some advice for someone approaching such a loved one?
I think when you approach somebody who has neurocognitive impairment, it is quite likely that you are going to run into resistance because, as I said earlier, people who have neurocognitive impairment tend to be the last ones to realize that they have problems. You will have to rely on getting their friends and family involved. So if you're noticing some neurocognitive impairment at work, if you're noticing their productivity at work being affected or their interactions with staff and clients being affected, I would recommend that you have this conversation with your friends and family and see whether everybody can rally around them and get them the help that they need.
And if you are speaking with someone and they decide they agree with you that, yes, I maybe do have some issues, what's your recommendation for that person to recommend to the individual?
My recommendation would be that this individual go and have a conversation with their primary care physician. They might end up needing to get some brain scans and a medical workup to figure out why they are having neurocognitive impairment. There are a few rare cases where if they are able to identify neurocognitive impairment early and they could have some reversible causes of their neurocognitive impairment that can be addressed by your primary care physician and hence can help you improve your cognition.
Thank you, Dr. Singh, for sharing your insight and thoughts with us regarding cognitive impairment. And thank you to all of you who have taken the time to view this segment of our Living Above the Bar series.